Welcome to Showcase Richmond. I'm Matt DiNardo. When it comes to medical visits and procedures, nurses tend to leave the most lasting impressions with their patients. Despite the never-changing need for thorough and compassionate nurse care, the healthcare demands on today's nurses are actually forever changing. To help advocate for nurses and their need for continuing education are the Virginia Nurses Foundation and the Virginia Action Coalition. This important work being done by these groups is the focus of today's Good News segment, being made possible by Care Advantage, changing our community one charity at a time.
Care Advantage means that I can face each day with a positive. You don't have to go to bed at night wondering, how am I going to get through tomorrow? Because you already know they will be here to help you get through that day. They care about the people they're helping. They're special.
Don't do it alone. Call Care Advantage and find the peace of mind you've been searching for.
With us now is Shirley Gibson, the president of the Virginia Nurses Foundation and the co-lead for the Virginia Action Coalition. Welcome to Showcase Richmond, Shirley.
Thank you, Matt.
Let's talk about this. Tell us a little bit about the Virginia Nurses Foundation.
Virginia Nurses Foundation is a nonprofit arm of the Virginia Nurses Association, which is there to support nurses, the 100,000 nurses in the state of Virginia.
Nurses obviously are a big part of our entire healthcare industry, so they need the support. What is the Virginia Action Coalition? It's the other branch that you're also representing.
Yes. The Virginia Action Coalition is a statewide initiative that is out of a national initiative from the Robert Wood Johnson's Foundation and the Institute of Medicine, which published the Future of Nursing IOM report, which is called Future of Nursing, Leading Change, Advancing Health. And we are trying to move forward 4 key messages for the organization.
How are you working to achieve this vision and get these messages across?
These 4 key messages are, one is around education progression. Education progression is wanting 80% of our nurses to have baccalaureate degrees by 2020. A higher educated nursing workforce means better outcomes for patients. Another key message in there is for us to have access to care, and that's around all nurses being able to practice to the full extent of their education and training. And most specifically around advanced practice registered nurses, it's very important because we're going to have a shortage of nurses, a shortage of physicians, as well as an aging population that will demand care. Advanced practice registered nurses can truly fill that gap for us in the future. So we need to make sure we can practice at the full scope of our practice. The third message is around leadership. Nurses bring great leadership to everything they do in clinical practice, and also as they participate in sitting on boards. And so we're working on getting more nurses on boards. Nurses are one of the most respected professions for the last 13 years in the Gallup poll. And so what we do is we can interpret knowledge for the public, and that's the value that nurses bring on a board, specifically hospital boards, what we're trying to work towards. And then the last key message is around interprofessional practice. Healthcare is a team sport, and it takes all of us to do that. Nurses can participate with physicians and other health professions. We are working with the Medical Society of Virginia to bring together dyads and triads of professionals to work towards team-based care.
All right, let's tell how people can help out the Virginia Nurses Foundation. We have some information on the screen for you. You can give them a call today. You can go onto the website. It's thevirginianurses.com, 804-282-1808. There's educational video there, fundraising campaign info. And again, as Shirley said, we really need to help and support our nurses. They are a large part of the backbone of our medical community, especially with the aging population. We'd like to thank Care Advantage for making this segment possible. You can get in touch with them, 804-323-9464, careadvantageinc.com. Thanks, Shirley.
Okay.